Remicade is one of the top 3 leading drugs for the treatment of Crohn's disease both in the nation and worldwide. Remicade provides a pain-free way of life for people who normally suffer from their disease symptoms. It allows them to perform their normal activities like they once did. Remicade is an innovative biologic drug that is easily accessible to patients through a prescription and can greatly improve their life. In 1989, at the New York University School of Medicine, 2 colleagues, Jan Vilsack and Junming They, created a monoclonal antibody against TNF-alpha. This then led to collaboration with the company Centocor, which is now Janssen Biotech Incorporated, to produce Remicade. Remicade is a brand of infliximab. Infliximab is the drug that was discovered by the 2 colleagues at New York University School of Medicine. Infliximab works because TNF-alpha is used in the pathogenesis of chronic inflammatory autoimmune diseases. Remicade then works by blocking this TNF agent. Biologic drugs overall work to control the inflammation in joints to ease the pain and prevent joint damage. When the immune system produces too many TNF cells, they start to mistakenly attack a person's healthy cells. Biologics overall target the part of your immune system that is attacking healthy cells and blocks them from doing so. By blocking these attacks, inflammation and joint pain is thus decreased. Remicade is an antibody against TNF. Antibodies are made from living cells. However, the human body cannot produce them at a commercial sale rate needed by Janssen Biotech Incorporated. These cells need to be immortal in the sense that they can continually reproduce. Cancer cells are a good example of an immortal cell. Cells can be made immortal through genetic engineering. Mice have been genetically modified to produce partly human antibodies, 70% human and 30% mouse. The 30% mouse is the reason for some allergic reactions to Remicade. The best cells at producing antibodies are then cloned. They're then put into bioreactors that create the perfect culture for them so they can produce more identical antibodies before being terminated, purified, and then sold. Janssen Biotech is a subsidiary of Johnson & Johnson Company. Janssen Biotech was formerly known as Centocor Biotech Incorporated. This was a biotechnology company founded in Philadelphia in 1979. It became acquired by Johnson & Johnson in 1999. They have increased annual sales from 500 million to more than 2 billion after being acquired by Johnson & Johnson. Centocor was founded by Michael Wall and Hubert Shoemaker. Johnson & Johnson is the owner of Janssen Biotech. Johnson & Johnson is one of the largest producers of consumer healthcare products. They have 3 main categories. These categories are consumer products, medical devices, and pharmaceutical products. Janssen is the title of the pharmaceutical company branch that produces Remicade. They aren't the biggest producers of Crohn's disease medicine anymore, but they were the first to commercialize the infliximab. As you can see by this chart, Johnson & Johnson has been steadily increasing over the course of the last year. Remicade has many uses. Its main use is the treatment of Crohn's disease, but it can also be used for many other things. Remicade can be used for the treatment of ulcerative colitis, psoriasis, psoriatic arthritis, ankylosing spondylitis, and rheumatoid arthritis. Remicade works by blocking the attacks of the TNF cells, thus decreasing inflammation and joint pain in the body. Remicade has shown to be very effective. There were two trials that tested the effectiveness of Remicade called ATTRACT and ASPIRE. Both were conducted on large amounts of people who were treated with randomized Remicade and methotrexate or a placebo and methotrexate. Both tests resulted in Remicade producing higher rates of ACR responses. There were also 4 other clinical trials that involved placebo and Remicade. All of these trials showed Remicade with an increased percentage of patients who achieved clinical response. These charts show the effectiveness of Remicade. In the first table, you can see the ATTRACT and ASPIRE study that I talked about previously. It shows the clinical response of the people taking the Remicade versus the placebo. In the second chart, you can see the radiographic changes from baseline to 54 weeks with Remicade in ATTRACT and ASPIRE. In the third table, you can see the SONIC Week 2 secondary endpoint. This was one of the 4 clinical trials later done. You can see the 63% of patients who achieve clinical response through the use of Remicade plus AZA versus the 56 who use Remicade and a placebo. In the fourth chart on the bottom, you can see the 50%, 7% of people in week 2 secondary endpoint who achieve clinical response with an initial dose of Remicade. In the last chart, you can see the Targan study, which was one of the 4 clinical trials, and the 81% of patients who achieve clinical response through Remicade versus placebo, and the week 2 secondary endpoint with 77% of patients who achieve clinical response versus only 17% with the placebo. All of these show the effectiveness of Remicade. Remicade is proven to be very effective at treating Crohn's disease. Remicade is used for the treatment of Crohn's disease. Crohn's disease is a large problem in the US, mainly affecting people 20 years and older. It affects about 0.32% of the population, which is a small amount, but is still significant. Crohn's disease is more common in women and found to be more common in Caucasians, as shown in the tables on the right side of this slide. You can see in the top table how Crohn's disease affects ethnic groups, in the second table how Crohn's disease affects age groups, and in the third table how Crohn's disease affects different regions of the United States. The regions are all affected pretty equally. The age groups are very different, with adults being the most cases, and the ethnic groups are pretty similar but still very skewed towards white. Crohn's disease affects 201 of every 100,000 U.S. adults. As shown through this chart, it's estimated 1.4 million Americans suffer from Crohn's disease or ulcerative colitis, both of which are treated by Remicade. About 75% of people with Crohn's disease have to undergo surgery, with 38% of people who have surgery experiencing a recurrence in the first year after. Remicade has 71.9 billion in Remicade sales worldwide. It's mainly marketed through commercials on the TV and the internet, as shown through the picture on the bottom right. This is a picture from one of Remicade's commercials that air regularly on television. Johnson & Johnson is a very large company. Thus, Remicade is by no means its only source of income, but it is one of its largest sources. In order to make a lot of money, people need to be spending a lot of money on the product. A year's worth of Remicade costs anywhere between $17,000 to $22,000, thus being a very costly drug. A person with Crohn's disease has to pay a lot of money to get the treatment they need. All biologic drugs are very expensive due to the requirements in production. Remicade has many different competitors. They have 78 different competitors, but the market is dominated by Humira, Pentasa, and Remicade. This chart on the bottom right shows the different drugs that are all competitors and their ranking and popularity. Humira, Pentasa, and Remicade are all very close, and then it drops off after that. Remicade has been proven to be a very safe and effective drug, so there are not many ethics involved with the Remicade used for treatment of Crohn's disease or other diseases, but there are ethics with the production of Remicade due to animal abuse because of harvesting cells from mice. Many animals are killed to harvest their cells and live very painful lives due to the different cells engineered in their body that cause them pain. Many of them have their blood drawn and are then sacrificed in order to create the drug to get the cells to then reproduce in the biological reactors. This has sparked interest of animal rights activists who are fighting for the safe and humane treatment of animals.